So the thing is that most breast implants do not last forever. They were never intended to last forever. So any woman who has had a mastectomy and breast reconstruction with an implant, over time, they're going to need to have revision breast reconstruction. One of the most advanced techniques that we can use is to remove the old breast implants and to replace it with natural tissue, utilizing a DIEP flap or a DIEP flap, natural tissue reconstruction, and then give them an entire new reconstruction that will then last them forever and feel more natural and look more natural. And very often, these patients also have pain and discomfort that we can fix at the same time. A lot of women have had breast reconstruction in the past and are dissatisfied with their appearance. At the time of their reconstruction, they were going through cancer treatments, they might have had radiation, and at that time, they felt that they had a good result. As time goes on, it changes, either because they have gotten older, they've gained weight, they've lost weight, they've had radiation therapy, they might have had more biopsies, and those patients can come to us and we can fix the bad appearance or the dissatisfaction that they have with newer techniques. The techniques that we are able to use for revision breast reconstruction or corrective breast reconstruction are very often the same exact newer advanced techniques that we now use for immediate breast reconstruction. And there's two basic different ways of doing it. We can either put new breast implants in, or we can transition someone to natural tissue reconstruction. Both of those are large operations. They might take a few hours. Sometimes it just means doing a small touch-up operation and doing some fat grafting or a breast lift to improve the overall shape and symmetry between the breasts. So some of these surgeries can be very short outpatient procedures. Some of them can be redoing the entire thing from scratch with a longer recovery. Because we specialize in breast reconstruction, we're able to offer our patients all of the available options for revision or correction of their previous breast surgery. That can include fat grafting, liposuction, breast lift, breast reduction, breast implant placement, removal of a breast implant, changing of a breast implant to natural tissue reconstruction. And unless somebody can offer you all of the techniques that are available for corrective breast surgery, you're not going to be able to figure out which one is best for you. And that's why you need to come to someone like our practice, where we specialize in breast reconstruction.